no pain. Imagine living like that. You go to the dentist, you don't need Novocaine. You have surgery, no anesthesia. That is the reality for a woman in Scotland. She's 71 years old. Her name's Jo Cameron. She has 2 rare gene mutations that make that possible, and she didn't even know about it. Doctors really didn't figure it out till she was 65 years old. Again, wow, unbelievable here. Let's bring in Dr. Jennifer Caudle to talk about this. She's a family physician and associate professor at Rowan University School of Osteopathic Medicine. So how is this possible? Tell us about it.
Well, I have to say, this is remarkable, and it's due to a gene mutation. You mentioned that absolutely correctly. But as you mentioned, that's right. She has not really ever experienced pain. In addition to that, she really never became anxious and had some memory problems over the years. But she reported things like having had prior surgeries and not needing any sort of pain medication afterwards, having dental procedures, getting cuts and burns, not even knowing that she had them because she didn't perceive pain, and even being able to eat hot peppers and not really experience anything. She said childbirth wasn't that big of a deal. Actually, that was what was written about her as she talked about her issues. On further testing, they found that she had a rare gene mutation, which I think is fascinating and will probably give us a lot of information about medicine in general in the future.
I'm sure clued in, a lot of moms out there are just listening to that quote, childbirth, no big deal.
Right.
That really kind of sums it up here. And you mentioned all the other things, low anxiety. What was the quote there? The hot peppers was just a pleasant glow in her mouth. I mean, wow. How rare is this, doctor?
I mean, this is really, really rare. And, you know, I actually read the case study in the journal that it was published in. There have been other people, we know of other people who have decreased, they experience pain at a decreased level, but no one really like her, because not only is it just pain that she doesn't seem to experience, but she doesn't necessarily get anxious in typically anxiety-provoking situations. So, for example, a car accident that she was in, it didn't really rattle her. And so this sort of constellation of symptoms really had researchers taking a look at what was going on. They realized that the gene mutation she had was a deletion of a part of a gene that caused increased circulation of other chemicals. But the thing about it is that this really may actually lead us to understanding pain better, and actually might even lead us to having other options to treat pain for other people. So it's kind of exciting in that way.
Wow. I mean, as you and I have talked about it, a lot of positives, at least that we're seeing. What are the downsides here?
Yeah, well, you know, again, I mean, I have to give it to this woman. And also what was interesting is in the reports, it said she didn't even realize that she didn't experience pain like other people. The childbirth example, she told other women, it's not as bad as they say. And other women are like, what are you talking about? So she didn't actually realize until her 60s, when she started to be researched and scientists were looking at her gene makeup, that this was actually her situation. Now, some of the downsides of people who don't experience pain is, remember, pain is a warning sign to us. It tells our brain and our body, hey, step away, back off, remove your hand from that hot stove. If you're not perceiving pain, you might develop injuries. You might sustain injuries and really do that unknowingly. And the other thing is anxiety. You know, it sounds really nice, the idea of not experiencing anxiety, but anxiety is also a protective mechanism. It tells us when to be afraid, when to be cautious, etc. So there are some downsides. But again, I think the upsides are pretty upside here. Yeah. Wouldn't it be great to have different modalities to treat pain based on some of the research that we're gathering from this situation?
Got it. Jennifer Caudle, great talking to you. Again, you said it remarkable. We'll keep following it. Well, a couple in Orange County.